everyone wants the economy to be open. I'm sure that every public leader, every government official wants nothing more than to reopen, although I hope they also want to do so safely and in a way that's compatible with data and evidence and science. Look, what we have right now with social distancing, with shutting down businesses and restaurants and schools, the idea is to reduce the transmission of the virus by stopping people from interacting with each other. Ideally, that is a stopgap solution. That's not permanent, but it's something that you do in the short term in order to reduce the case numbers and in order to get the public health infrastructure to be strengthened so that you don't have hospitals that are overwhelmed and so that you're able to trace individual contacts and isolate those who test positive and all those that they get exposed to. So I think as long as we follow those types of general public health measures and follow the data and the science, we'll be able to reopen safely. But as you said, we cannot jump the gun because if we do, then we face having a resurgence that could even be worse than the first wave. And that would mean that there are many more infections and many more people who would unnecessarily die.
Yeah, that indeed is the case. So what should be the right approach? Is being cautiously optimistic the way forward? And how would you put cautious optimism on a timeline given where we are today and comparing that to where perhaps we would be by the end of 2020?
Well, cautious optimism is correct because we have been able to change the trajectory. So many countries around the world have been able to reduce the number of deaths by implementing these social distancing measures, by shutting things down, essentially. The problem, though, is that until we get a vaccine, which may not be until for another year and a half, until we get a vaccine, we will see some element of social distancing. It's just a matter of how we implement them and what we can roll back first. So I think the key is three things. One is we have to have mass testing in order to know what the true numbers are. Second is we have to stabilize the healthcare system so that we don't have it all be overwhelmed at the same time. And then third, we have to have the public health structure in place to be able to do that contact tracing. And we also have to have general tolerance for what happens when we reopen, and there will be many more cases, but then we may have to shut down again. And I think we're seeing that in governments around the world that are trying baby steps, that are trying to reopen a little bit at a time and then seeing what happens as a result.
And Leana, this issue around testing is so critical. It's also been a point of contention between President Trump and some governors who worry that testing isn't adequate. Do you think testing is adequate enough at this stage in terms of the availability of test kits to start the reopening?
In the U.S., not at all, not even close. Look, most places here are only testing those who have symptoms and are very ill. For example, they're in the hospital, in the ICU. Even people who have mild symptoms are not able to access testing, much less patients with no symptoms at all, which is what we need to get to if we are to actually find out what is the true prevalence of coronavirus in our communities. So we have a long way to go for testing, and I'm afraid that the longer we wait, the more time it's going to take us to actually do the social distancing. So the longer it's going to take to reopen our economy. Every day that we waste in not getting those tests is a day that we waste in not reopening the economy and potentially more lives that are cost as a result too.
Hi, I'm Emily Tan, and thanks for watching CNBC. You can check out more of our videos by clicking on the boxes on the screen, and don't forget to subscribe to the channel for more. Thanks for watching.